Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's focus on the EM findings of in case of the renal diseases. So the first disease we are going to look at is the Alport syndrome. It has a basket weave appearance. Then comes a post-infectious glomerulonephritis. So here there is a primary subepithelial humps and the endothelial deposits in early stage diseases. Then the good pasture disease. So this is the good pasture disease or the syndrome. This is a disruption of the globular basement membrane, GBM. Then comes the membranous nephropathy. Membranous nephropathy is the subepithelial deposits. The membranous nephropathy, subepithelial deposits. Then the minimal change disease will be the effacement of the food process. The focal segmental glomerulosclerosis, this will be the loss of the food process or the epithelial denudation. That is the MPG, and MPGN stands for the subendothelial deposits. Now let's look at the dense deposit of the disease. This is the MPGN type 2. This involves the dense deposits. Next is the IgA nephropathy. IgA nephropathy, that involves the mesangial and the paramesangial dense deposits. Mesangial and the paramesangial dense deposits. To learn and grow daily like this, please do subscribe.